More than 1,000 different medications can cause liver damage. Fatty liver disease now affects at least 25% of adults globally. Your liver processes everything from your morning coffee to your prescription medications, working around the clock to filter toxins from your system. When it becomes overwhelmed, it may show up as symptoms you won't link to the liver. I'll walk you through 10 warning signs you can check yourself, and the simple, clinically supported steps to lower the stress on your liver. These signals show up as seemingly unrelated symptoms throughout your entire body. From unexplained fatigue to strange skin changes, your body is trying to warn you that this vital organ needs your attention. This organ performs over 500 different functions every single day, yet most people can't name even 5 of them. This 3-pound powerhouse sitting quietly in your upper abdomen operates as your body's central processing plant. It carries out hundreds of reactions and makes thousands of proteins, including albumin and globulins, that keep your blood functioning properly. Your liver manufactures bile to digest fats, stores glucose for energy, and can even create glucose from scratch when you need it. It produces albumin, the protein that keeps fluid in your blood vessels, and creates the clotting factors that stop you from bleeding to death from minor cuts. Your liver processes hormones like estrogen and testosterone, converts thyroid hormones into their active forms, and stores vitamins A, D, E, and K. Modern life systematically attacks this vital organ through 3 major pathways. Processed foods loaded with high fructose corn syrup force your liver to convert excess sugar into fat. Prescription medications and over-the-counter pain relievers require constant liver processing. Environmental toxins from cleaning products and pesticides create additional detoxification demands around the clock. The earliest common stage is accumulation of fat inside liver cells, often driven by insulin resistance and excess dietary sugar. That congestion reduces the liver's ability to do other tasks. When your liver becomes overwhelmed with sugar processing, it starts storing excess glucose as fat within liver cells. Before we jump to the next point, to keep this channel going, please hit the subscribe button. It truly makes a difference. Thank you. The organ becomes congested, like a traffic jam that slows down all movement through the system. This metabolic disruption creates a domino effect throughout your interconnected body systems. When your liver can't properly process hormones, you develop hormone imbalances. When it struggles to produce adequate bile, fat digestion becomes impaired. When detoxification pathways become overwhelmed, toxins begin accumulating in other organs and tissues. Your liver doesn't have pain receptors, so it can't directly signal distress through pain. Instead, when your liver becomes overwhelmed, it communicates through warning signs that appear throughout your entire body. These symptoms often seem completely unrelated to liver function, which is why most people miss the connection entirely. Some of these signals are hiding in the most obvious place you look every day. Your skin serves as a window into your liver's internal struggles. A simple glance in the mirror could reveal 3 different types of liver distress signals hiding in plain sight. When your liver can't properly process toxins or metabolize hormones, these problems don't stay hidden inside your body. Instead, they surface through visible changes that most people dismiss as normal aging or minor cosmetic concerns. The connection between your skin's appearance and your liver's health runs much deeper than you might expect. What looks like a simple skin issue often represents serious internal organ stress that demands immediate attention. Pay attention to small, yellowish bumps that appear around your eyelids. These deposits, called xanthelasma, are cholesterol plaques caused by disrupted cholesterol and bile metabolism. Your liver normally converts cholesterol into bile acids for fat digestion. When this process becomes disrupted, cholesterol accumulates in your bloodstream and eventually deposits in the thin skin around your eyes. If you notice xanthelasma, ask your clinician about lipid and basic liver testing. Even more alarming is a bronze or grayish skin coloration that develops gradually across your body. This metallic tint signals dangerous iron overload in your organs. Bronze skin could mean iron overload. Ask for a ferritin test, not just serum iron. Serum iron measures circulating iron at one time point, while ferritin estimates stored iron. This iron buildup creates oxidative stress that destroys healthy tissue in your liver pancreas, and heart. The yellowing of your skin and the whites of your eyes represents another critical warning sign. This jaundice occurs when your liver can't process bilirubin, the yellow waste product created when red blood cells break down. When your liver becomes congested, bilirubin accumulates in your bloodstream and deposits in your tissues. Many people with liver dysfunction also experience intense, widespread itching across their skin. This happens when bile acids back up into your bloodstream instead of flowing properly through your digestive system. These retained bile acids irritate nerve endings throughout your skin, often worse in hands and feet because of circulation patterns, creating persistent discomfort that topical treatments can't resolve. These aren't cosmetic issues, they're metabolic warnings that your liver is losing its battle against toxin overload. But liver dysfunction creates even more surprising symptoms that affect completely different body systems. Men developing breast tissue and women experiencing vision problems at night might seem unrelated, but they share a shocking common cause. When the liver can't clear hormones, it leads to hormone imbalances. Excess estrogen can accumulate and produce symptoms like breast tissue enlargement in men and spider veins in both sexes. Your liver also produces the bile acids essential for absorbing fat-soluble vitamins. Without adequate bile production, your body can't properly absorb vitamins A, D, E, and K, regardless of how much you consume through food or supplements. This absorption failure creates deficiency symptoms that seem to have nothing to do with your digestive system. Here's what to look for: gynecomastia, spider veins, and worsening night vision. When men develop enlarged breast tissue called gynecomastia, the root cause often traces back to liver dysfunction. Your liver normally breaks down estrogen, the female hormone that men produce in small amounts. When the liver becomes overwhelmed, excess estrogen accumulates in breast tissue, causing enlargement and tenderness. Spider veins that appear across your chest, shoulders, and face also reflect this same hormonal disruption. These small web-like blood vessels develop when elevated estrogen levels cause blood vessels to dilate and become more visible through your skin. Women and men with liver dysfunction often notice their night vision deteriorating. The liver also produces retinol-binding protein, which transports vitamin A to your retina. Your eyes require vitamin A to produce rhodopsin, the protein that allows you to see in low-light conditions. This same bile acid deficiency affects absorption of vitamin D, leading to bone weakness, vitamin E deficiency that damages cell membranes, and vitamin K deficiency that impairs blood clotting. These hormone and vision changes can have other causes, so medical evaluation is important rather than self-diagnosis. But the cascade of liver dysfunction extends even further into unexpected areas of your health. Your shoulder pain, chronic fatigue, and digestive issues might all trace back to the same overwhelmed organ. When your liver becomes severely compromised, it creates a cascade of symptoms throughout your entire body. These final warning signs represent the most serious stage of liver dysfunction, yet doctors often treat them as separate, unrelated conditions. Right shoulder pain, referred pain from liver and gallbladder stress that travels along shared nerve pathways. This musculoskeletal pain feels exactly like a pulled muscle or joint problem, leading many people to seek orthopedic treatment for what is actually an internal organ crisis. Fatigue, liver's metabolic failure can sap energy production. Your liver produces the glucose your cells need for energy and creates the proteins that transport nutrients through your bloodstream. When these processes become disrupted, your body cannot maintain normal energy production, creating persistent tiredness that rest cannot resolve. Pale floating stools, poor bile flow prevents proper fat digestion. This condition, called steatorrhea, occurs when impaired bile production allows dietary fats to pass through your intestines undigested, creating loose, foul-smelling bowel movements that indicate serious bile flow obstruction. Abdominal swelling and leg edema. Low albumin from a failing liver causes fluid leakage. Albumin acts like a blood sponge that maintains proper fluid balance in your bloodstream. Without adequate albumin, fluid leaks out of your blood vessels and accumulates in your abdomen and legs, creating ascites and pitting edema that worsens throughout the day. Increased allergic reactions and chemical sensitivities. A congested liver allows metabolic byproducts to accumulate, which may increase immune reactions and sensitivities. You may notice heightened reactions to foods you previously tolerated, sensitivity to chemicals and fragrances, or frequent skin rashes from seemingly minor irritants. Ask your clinician for ALT and AST liver enzymes, CRP for inflammation, and request ferritin specifically when iron overload is suspected. These tests sometimes miss early disease, so symptoms matter since substantial liver function can be lost before standard tests trigger alarm. These diverse symptoms all connect to the central problem of liver dysfunction affecting every body system. But there's encouraging news about your liver's unique ability to heal itself. Your liver possesses remarkable regenerative capacity that sets it apart from every other organ in your body. Unlike your heart or brain, your liver can rebuild damaged tissue and restore normal function when you provide proper support. Here's what to do now. Ask your doctor for liver enzymes and ferritin testing. Cut the 3 biggest liver stressors: added sugar, especially high fructose corn syrup, alcohol, and unnecessary medications. Eat sulfur-rich foods like garlic, broccoli, onions, and cruciferous vegetables to support glutathione production. Avoid processed foods and inflammatory seed oils. If ferritin is high, discuss blood donation with your doctor as the standard treatment for iron overload. Before starting supplements or stopping prescribed medications, consult your clinician. Many people see measurable improvement with diet and lifestyle changes in a matter of weeks. If you found this list useful, comment which of these 10 signs you recognize or which one surprised you most. If you have these signs, see your clinician for proper evaluation. Please check out our next video above. See you shortly in the next video. Thank you.